Good day, everyone. My name is Dr. Fundi Lenyati, aka Dr. Fundi. Today, this is another episode that follows on an episode that we made about 2 weeks ago. We are still going to talk about the National Health Insurance. 2 weeks ago, we focused on the NHI because the Portfolio Committee on Health in Parliament, they had just approved the National Health Insurance Bill. Since that event on the 26th of May, a lot has happened, and we thought it is important to have a follow-up podcast. Today, it's not going to be a monologue like I had last time. I've invited two people. One of those is representing the young people of South Africa, somebody who stays, in the northern suburbs of Johannesburg, Mr. Nilton Mabaso. Also, one of my team members, Mr. Sipho Masigo, that you will not see in the podcast, but his voice is definitely going to be heard. He is representing the people of the South, the Sowetos and other places around, the people who are dependent on the public health system, the people who are looking for change as far as access to healthcare. Welcome, both of you gentlemen.
Thank you, Doc. Thank you, Doc.
So today's podcast is going to be more of a Q&A, question and answer kind of podcast, because I think it's important for people to hear what other people in the country are thinking, because there's been a lot of media attention on the NHI, and it's important to hear about what are the questions on the ground. And so both gentlemen, representing the different constituencies of South Africa, they will pose questions to me, and I will try to the best of my ability with the limited information that's available to try and give answers to their questions. So I'll hand over to our ghost man, Sipho Masigo, that is not in view, but like I said, he's going to be asking a lot of questions. Sipho, you have a huge responsibility to ask questions representing the majority of the people of this country who are looking for change, who are dependent in the public healthcare system, and who are looking at this NHI to see whether it is something that will make their lives better. So over to you.
Absolutely, Doc. And good evening, good afternoon to all the listeners of the Dr. Fundi Health Matters podcast. Doc, I think for me, the first question I have is, what is universal health coverage? What is NHI? I don't understand what it is, Doc.
Well, I think it's important to start there. My parents were teachers, and one of the things that they told me was that before you talk on any subject, it's important to make sure that you are on the same wavelength. So defining a subject is actually quite important. So let's start by saying, universal healthcare coverage, it's a national system of healthcare whereby every citizen of the country has got access to quality healthcare. Healthcare that they don't have to pay for at the point of service. It's already paid for by those who are contributing to that healthcare system. That is, those who are in a financial position to do so, but also for those who are unemployed or indigent or retired people, then the government, covers for those people. So universal healthcare coverage is that system of healthcare to make sure that no one is left behind. It's a resolution of the World Health Organization, of which South Africa is a member, a resolution that by 2030, every country should have some form of universal healthcare coverage. So in South Africa, in line with that resolution, we have then come up with a unique offering that is called the National Health Insurance. So the NHI is a form of universal healthcare coverage for the South African environment. So that is what is causing a lot of conversations. Other people are up in arms because the government is actually forced by our constitution, section 27.2, to find a solution to make sure that no one is left behind. Our constitution, section 27.1, says everybody should have access to quality healthcare. So this NHI is an attempt to ensure that that basic right in our constitution actually becomes a reality for all South Africans.
So, Doc, my second question is, I think you've covered it quite well, but Doc, people are not happy about this. People are confused. I've seen on the news, doctors are not happy about it. People who are using medical aid are not happy about it. Why are so many people either misinformed or don't understand what this thing is? Where is the problem?
Well, I must say that, the whole idea of a national health insurance, obviously it's an idea that came from the ruling party, the African National Congress, okay? But they are the ruling, party in government. And so they have translated their vision of how to transform healthcare through this NHI policy. So since around 2010, they took steps to now make it a reality. So it's been there for some time. There's been white papers and everything, engagements with different stakeholders. And then in 2018, the NHI bill came to be in existence. And there were further engagements with stakeholders. Again, there were certain amendments that were made to that initial NHI bill to have the amended NHI bill, which is the one that on the 26th of May was eventually approved by the Portfolio Committee on Health in Parliament. Now, to answer your question specifically, why are people up in arms? Well, as much as there's a lot of engagements that have taken place on this NHI bill with organized stakeholders, the average South African has not really been engaged to the extent that everybody is aware of what this NHI is. So I think there has been a vacuum from a communication point of view. And so now that people are hearing that this thing is becoming a reality, it's now been approved, with the Portfolio Committee on the 26th of May. It's also now been approved by the National Assembly on the 13th of June. And today, being the 22nd of June, it's coming before the National Council of Provinces. So people are now worried because they can see that if it's approved today, the next step is for it to go to the presidency and for the president to consider, and he may even approve it thereafter. So it's moving very, very fast in the eyes of the people, yet they know very little about what it is. And so based on that, there's a lot of anxiety about how will it affect people as individuals or as professionals and all of that. So that's why people are concerned about it.
Doc, I think let me hand over to the young man representing the northern suburbs.
So prior to today, as embarrassing as it is, I had no idea what NHI is. Well, other than the abbreviation, I thought it was some stuff to do with medical students. Because I did see that there's a fuss about people wanting to leave the country. It was like in the health sector. So now to find out that there's such a thing happening my immediate concern or my immediate worry is on my own insurance, like my own medical insurance. So how does that work? If you have, like, so with your own private medical insurance, there's certain benefits, there is certain clinics, hospitals, certain type of service that you receive. And I think it's the main reason why we signed up for this medical insurance, is to say, okay, I know that there's a specific level of service that I'm expecting and that I'm willing to pay for, and willing to receive. So what we've seen is once something is available to everyone, we have, a decline in service level, because now we're looking at quantity more than quality. Yeah, so I think that's one of the major concerns, to say, okay, what does that mean for me who used to pay for this specific level of service, and not taking away the fact that everyone has the right to, quality healthcare and stuff, but I'm now looking at it from a more service view, to say I had a medical insurance because I knew that, okay, by this specific hospital or this specific clinic, I know I can get quicker service. There's no lines and all of that, because with public hospitals and clinics, there's lines.
The waiting period is quite long.
The waiting period is quite long, and now if we have a universal type of insurance, then it means that there's no longer that, or the type of service for me to say, okay, I can be like, I can just go in here, as a young entrepreneur, I don't have time to be standing in line to be dealt with. So I can go in here, get this done. If they say 10:30, it's 10:30. And then I'll be done by 11. I can continue with my day. But in a setting where I have to wait in line, the time periods, they're not very specific. It means,
Well, I must say that your concerns are valid. Countries like the UK that have had the National Health Service for over 50 years, they still are burdened by the issue of long waiting lists to do some of the basic procedures, for example, like removal of cataracts or other procedures. So your concerns are real, because you are saying to me, you have the healthcare, insurance because you want convenience.
Yes.
And your concerns now is whether you'll still have the convenience in the new order that is being planned, that is under the National Health Insurance. I must say that the way this thing is planned, everybody who receives an income, whether it is formal employment or informal employment, they're going to have to contribute, via SARS to a National Health Insurance Fund. Now, this National Health Insurance Fund will also receive monies from government for those people who are unemployed or indigent. Yeah? So there will be this one big pool of money.
Yeah.
Now, that fund, they talk about a single payer system. Yeah? So NHI will be the only single payer of healthcare for all of us in the country. Mm-hmm. Yeah? All of us, we're going to need to make use of service providers. Some of those service providers will be service providers that are from the public health sector. Others will be from private health sector. So it may still be possible that you'll be able to access your nearest hospital or nearest, doctor. The details have not yet been worked out clearly. But the point is, you won't just now wake up and think that, I'll go and get this particular doctor or, it may well be that your favorite doctor or favorite hospital is not going to be able to see you, because there may be a possibility that people in a particular locality will be allocated to a particular hospital or particular specialists and doctors. But the details I have not yet come up, but where it works, people are allocated to nearest, health facilities. So, but the point here is that depending on the number of people in the area where you reside, there may be, the challenge of long waiting lists and all of those things. So your anxiety is definitely realistic. So, but these are the things that need to be addressed from a communication point of view, because South Africans, all of a sudden, they now take this NHI seriously, and they do want to get answers. Unfortunately, the comms side of the National Department of Health, I think it's lagging behind in terms of ensuring that everybody understands what will this thing entail. And some of the people who are actually opposing NHI are saying, how can they vote on something where there's still detail that is not being communicated? So, but at the same time, is that enough reason to stop the process from going forward? I think it depends on which side of, the debate, one resides in.
Just a follow-up question to that. So, I mean, we've seen in South Africa with all public services, that other than the long waiting times and stuff, so if we're getting rid of and that's my assumption, that might not be the case, but basically getting rid of the private sector of like health, like, the big companies that we used to have specific medical aid for, because I think we wouldn't need them in that type of setting or in that type of environment, because if we're paying to the National Health Insurance Fund, then I don't need to have my own medical insurance. And then that means that they are now not needed, or is there a plan for those businesses to continue operating or with additional services? And do you maybe have an idea of what those additional services may be? Because if I wanted to start my own medical insurance company, I don't think now the setting would be favorable for me in that case, because the one thing which was a main selling point was the quality and the convenience. And you no longer have that, because you now remove the convenience part of stuff,
I think there's something I need to correct. The fact that the private sector, that is the service providers, will still be there. Private hospitals, private clinics, private they will still be there. What they need to do, there are certain standards that that will be given in terms of, if you want to provide this service, these are the minimum standards in terms of your facility. It must work 24/7, 365. It must have this and that and that and that and that. So if you are a service provider and you believe you can deliver to the minimum requirements of the NHI, you will then apply to be accredited by the NHI, so that your facility can then be amongst the facilities that will deliver the service. So if your service does get to be accredited, public or private, then your facility will be amongst the facilities that will deliver the service. So private sector service provision will still be there. What the bill is threatening in the private sector is the fact that once the NHI is fully implemented, the private medical schemes will cease to exist as they are. They will only be seen to be complementary, kind of what you call top-up, funders. That is, to fund things that are not funded by NHI. Obviously, that has got is going to cause a lot of problems because many medical schemes will not survive. And there will only be a handful that can exist as top-up insurers because they cannot cover for anything that the NHI is covering for. So that's the only change. The private healthcare funding is going to change drastically. But also, as people will be paying to the NHI, they will have very little left to contribute for top-up kind of services. But obviously, there are people who are very wealthy who will be able to pay for NHI and still be able to pay for top-up or bells and whistles that are not covered by the normal, NHI basket of services. So the point I wanted to make was to just clear the fact that the private sector service provision will still be there for as long as they meet the minimum requirements, then they will be accredited. The only change that I think it's section 33 of the NHI bill, the one that says once it's fully implemented, schemes will cease to exist in the current form and they will only have to be complementary kind of thing. And that's one thing that is going to cause a lot of legal challenges to the NHI, that particular clause. Others are questioning, obviously, the issue around the powers of the Minister of Health, because in that bill, there are huge powers for the National Minister of Health and the committees that will be advising him. So for you, the anxiety, I think, is actually realistic. It is likely that many people who are medical aid members now will not afford to have the NHI membership contribution and also to contribute for top-up, for any service that is not covered by NHI. So it is an area that still, in my view, needs further, conversations. Yeah.
Just another one, Doc, for you is that the last recording that we did, the last podcast you did, you gave a broad picture with regards to what NHI is.
Yeah.
What has been the developments in the last 2 weeks regarding this issue?
Well, I must say that the last 3-4 weeks have been actually quite, quite eventful in the process of bringing NHI to life. I mentioned in the last podcast that on the 26th of May, the Portfolio Committee on Health in Parliament approved the NHI. There were 10 people who were voting there, and it was a 6-4. 6 for NHI and 4 against NHI. Almost 2 weeks later, on the 13th of June, that is Tuesday last week, the National Assembly debated the NHI bill, and the majority of the parliamentarians, they voted in favor of the NHI bill. But there's still certain steps that need to take place, and one of those is that the National Council of Provinces is debating that NHI today, and likely that by the end of today, it may be approved at that level as well, because the majority of the people in Parliament are ANC, deployed. After that, then it will have to now go to the presidency. That's my understanding, where he has to consider, the bill, its constitutional provisions, and any other challenges that may come from stakeholders. And this is where I think there's going to be a lot of legal challenges as well, and you'll have to consider those and see whether there is merit to send it back to Parliament for further engagements with stakeholders, or for amendments of certain clauses based on the inputs, because most people were complaining that the inputs that they gave to the parliamentary process were not taken into account. There were very few or minor changes that took place, so they feel that they were ignored. So the president may have to consider their plea, or may be forced by the courts to make changes. Or he can just ignore everybody and go ahead and sign it into law, which I think would be a bit short-sighted and would cause more problems. But anyway, this train seems to be moving ahead. Like I say, the portfolio committee saying thumbs up, the National Assembly saying thumbs up, and now today the National Council of Provinces about to debate it, and I think it will also be approved at that level as well. But the big question is, will it be signed into law with all the opposition that is on the ground, largely from opposition parties or other interest groups?
I guess my last question before I hand over to the North Boy. Doc, we know that the country's finances are in trouble. Can we afford this?
That's a very difficult question that you are asking. As a country, our finances as a country are not at the best shape, especially after COVID-19 pandemic and what it did. So it's been something that has been debated by a number of people to say, let's say this NHI is something that we really need and we're happy for. Is this the right time? Is it the right time? But there's differences of opinion. In one of the webinars where they had experts from the UK and other parts of Europe, there was one of the experts who actually said it is at times like these that you actually need to introduce this radical, health insurance. In the UK, the National Health Service was introduced just after, I think, the World War II, when the finances were not so great. And it is working. Yes, not perfect. So there is that argument that says you can't postpone it. But there's also an argument that says it doesn't have to be a big bang, where everything is introduced at once. It can be phased in depending on the finances of the country. But there are those who are also saying it should be, put on ice up until things have improved. So there's varying views about whether it should be implemented. I mean, the target date was 2026, and we are now just 3 years from 2026 for it to be fully implemented. So I'm not sure. What I think the legal challenges are going to put a pause on this process for some time. It may take another 5 years, looking at the amount of opposition and the depth of the pockets of the people who are opposed to this national health insurance bill.
Yeah. I think from my side, I just have one final question.
You look sad. You look sad. I mean,
I'm very stressed. And the reason why I'm stressed is I do understand that a lot of first world countries have implemented this for a long time.
Yeah.
But I think when we look at the landscape of South Africa as a whole, we, technology-wise, we're really not that advanced.
Yeah.
There's a lot of technologies that are only being phased in now, that should have been phased in a long time ago. And I think that attributed a lot to those other countries being able to effectively use their national or their version of the national health insurance.
Their universal health coverage.
Yes. So my thing, it just goes back to efficiency and like services. It's only, I think it's been a year or two since for like driver's license that we got a website where you can book a slot and stuff. You know, I'm not sure if those conversations are in conjunction with, you know, the implementation of
the
bill.
Your question is, do we have the infrastructure to deliver on NHI? And obviously, you being a technology expert, you know, is one of the things that obviously jumps into your mind. The technology infrastructure to drive this massive thing. Does South Africa have that? The answer is definitely that at this moment, you know, we are seriously challenged, especially in the public health sector. We are seriously challenged as a country. The previous Minister of Health, Dr. Mkhize, amongst his 9-point plan or 7-point plan, I think, he highlighted the issue of technology, because to drive something so massive, certainly there needs to be huge investments in the technology, the record system, so that you don't have to carry a file from one hospital to the other. You know, the results being, you know, available at the press of a button, and so many other things. So we are not there. And I think, again, the question is whether we should be going ahead at this point, or we should start by beefing up the infrastructure in terms of technologies, in terms of the physical buildings, in terms of the equipment, in terms of staffing, and all of those things that are critical to deliver a quality service. So that's the debate that is raging out there. Why don't you start by improving the infrastructure and everything else that is necessary before you introduce this thing? And people are saying that looking at the current public health system. The private sector, to some extent, is quite advanced. But I must also say that the private sector is no panacea to the problems that we have. They have got their own unique problems, which is the cost of healthcare is very, very, very high compared to, you know, other parts of the world. There's a lot of wastage. There's a lot of corruption. There's a lot of over-servicing, something that was found by an inquiry that was, you know, commissioned by the Competition Commission. So as much as we think it is working well, it also has serious problems. And a lot of people are buying down on medical schemes because they can't afford. So the funding system for the private sector, which is medical schemes, are not in the very healthiest of positions. A number of medical schemes are merging and others are actually disappearing. So if you look, let's say, 10 years down the line, there may be problems around the funding of private health care. So I think, you know, when the minister spoke in the National Assembly, he said there are two trains that are running parallel to each other. Both of them are heading for a crash. And so they are looking at how to get these two trains to join their strengths to be able to deliver. But it is the how that is done that's important. You know, the devil is in the detail. And at this point, there is a promise about what NHI will deliver, but the devil is in the detail. And I think as South Africans, we need to continue to have serious conversations about this. This is the most radical transformation of a health system since this country, became the new South Africa from the disjointed and fragmented health services pre-1994. And as it is, those who are benefiting from the status quo are obviously going to oppose, and those who are actually looking for change because they had problems in the access of quality of healthcare services, they are actually saying, go ahead. But we are polarized as a country, and like we did pre-1994, I think we need to talk, find each other, so that at the end of the day, this system is a system that has taken into account the views of all South Africans, so that the chances of success are much higher. But if we leave certain sectors or certain stakeholders behind and they are raising valid questions, we may actually be shooting ourselves in our feet. Sorry.
Okay, cool. I think I'm covered for now, Doc. I'm happy. I think you've given me a lot to think about. I am still worried.
Yeah, what are your concerns? What are your other concerns? Let's say now, you and your family.
I think, if I look at if you look at the public health care, I mean, my mother was sick at some point.
Yeah.
And I didn't have medical aid for her.
Yeah.
So I took it to Helen Joseph.
Yeah.
I look at the staff shortage, the medication that's not there.
Yeah.
And sometimes they give you the wrong medication.
Yeah.
They just give you a packet full of tablets.
Yeah.
There's no proper communication.
Yeah.
So already the overburdened public health care is a problem.
Yes.
And then on the other hand, my family and I rely or maybe use at times private health care.
Yeah.
And then you then think, we are all going to be put in the same basket.
Yeah.
Whereas the state has no capability of handling what it already has. So that's where my concern is.
Yeah. Look, once again, I think your anxieties or your concerns are valid, and which is why we need to engage more about those. Because how do you convince people to actually move into something that they will think they are losing out from what they are used to? But on the other hand, there are those who were not having any form of access, because maybe they are in informal settlements or in the rural areas of deep Eastern Cape or Limpopo. How do you convince them that they must continue to have challenges with access to quality healthcare? So I think what's important is no one must be left behind. And I think the National Department of Health has to, continue to engage so that the views of South Africans, can actually be taken into account. Otherwise, I think we are heading for a serious, fight. I'll put it that way. Just a few months ago, there were strikes by one of the big unions in the healthcare system, and we saw how that affected service delivery. Now, if civil society working with those unions and other interest groups actually protest against this, I don't think it will be good for the country. But anyway, sometimes you need to allow processes to take place. I think every South African must make it their business to learn about this national health insurance, learn about this bill that is likely to be passed today, in addition to the National Assembly and the Portfolio Committee, so that people don't just raise questions, they must raise informed questions. So let's make it our business, all of us, to go and read about the National Health Insurance Bill and look at what are the valid issues. I mean, the young people who are medical students or young doctors are already threatening to emigrate. And this is in a situation where, as South Africans, we have a shortage of doctors and other healthcare professionals. And if we have further brain drain, how will that affect this NHI that is being, planned. So I think let's go back to what we did between 1990 and 1994. Let's talk, convince each other, address the concerns, rather than steamroll the process. I don't think anyone is opposed to universal healthcare coverage. That is, everyone having access to healthcare. But it is the how that is planned to be implemented that makes many people to be concerned or even in opposition to what is being planned.
No, makes sense. Makes a whole lot of sense.
So, do you have any question? A wrap up, last views.
So, you just mentioned that medical students are threatening to leave the country. So, my question is, does that mean that the introduction of the national health insurance mean a reduction in the salaries of doctors? Because then what would then lead to them leaving the country?
No, I don't think it's about the salaries, but it's about the working conditions. Already, the working conditions in the public health sector, which covers the 85% of the country, are not so great. There's a lot of posts that are vacant and unfilled because provincial health departments don't have the budget. So the question now is, if many people choose to go to Canada, Australia, the UK, to practice their medicine there, what will it do in terms of the delivery of healthcare under the National Health Insurance? It could well be that they are threatening because they don't have enough information. But I think it's important to engage because the future of this country is on those young professionals. People like me in 20 years' time, they won't be practicing medicine. And so I think it's important to engage the young people. And you are here, you interact with them, listen to their views, and maybe we'll have another show where you can come and share with us what is it that they are saying, what is it that is making them anxious. And they're saying, as soon as I get my ComServe, and get my certificate, I'm out of here.
No, I think we're happy with that, Doc. Thank you so much for the lesson. I hope our viewers and our subscribers are enjoying the topic and are learning a lot from this.
Yes, I hope. For me, at this moment, I'm just bringing in information that is out there. I'm not advocating for this way or that way. All I'm looking for is let's talk. Let's talk, because South Africa does things better when everybody talks. There are valid, questions from those who are opposed, but at the same time, there are pressures on the government to deliver on the constitutional obligations. And how do we meet each other in the middle and ensure that we deliver something that will work for everybody? So I think let's wrap up for today. Until next time. And this will be, in our YouTube and other social media channels. So you can comment in those platforms. We will look at the questions there and be able to take them into account when we have another follow-up session on this national health insurance.
Absolutely. Thank you so much, Doc.
Thank you, Nilton, and thank you to you, our ghost man. Thank you.
Thank you.